along with my dear colleague and Prime Minister, Sarah, and my brother, Dr. Tedros Ghebreyesus. Since its formation, the ACT Accelerator has made remarkable progress in fulfilling its mandate to make available to the most vulnerable countries the tools that they need to fight this pandemic. Today's meeting is an important meeting, and it is as important and necessary as our first meeting. The COVID-19 pandemic is far from over. Even before the emergence of the new Omicron variant, many countries were experiencing rising infections, increasing hospitalizations, and even deaths. As the events of the past few days have shown, we live with the threat from mutating variants, which have the potential to unleash further devastation in communities globally. We do not yet know whether the Omicron variant is transmitted more efficiently, whether the variant increases the risk of reinfection, whether the variant causes more severe disease, or how effective the current vaccines can act against this variant. And yet, several countries have decided to isolate a number of countries on the African continent. We should be concerned that some decisions are no longer informed by science and are not taken on the basis of exercising solidarity. This pandemic has shown how we respond to a truly global crisis. It has shown several shortcomings and weaknesses. But we can and must improve how we respond to crises. The lives and livelihood of billions of people are at stake here. We have repeatedly said that no one will be safe unless we protect vulnerable populations everywhere. We do have a part of the solution, the Access to COVID-19 Tools Accelerator, which, if fully funded, would provide low middle income countries and low income countries with vaccines, treatments, testing, and PPE for frontline healthcare workers. There are two important lessons we need to draw from the current situation. Firstly, vaccine inequality is dangerous, but it is also completely avoidable. A year into the world's most ambitious vaccination drive, no country should lack sufficient access to vaccines. Yet, of the nearly 7.5 billion doses of COVID-19 vaccines administered globally, by mid-November, 71% had been administered in high-income and upper middle-income countries. Only 0.6% had been administered in low-income countries. Africa is the hardest hit by inequitable access to these life-saving vaccines. Secondly, we need to invest in all aspects of pandemic response. Alongside vaccination, testing, and genomic surveillance are needed to identify disease hotspots and to track the emergence of new variants. Treatments, including medical oxygen, are needed for those severely affected by COVID-19. Exciting potential treatments are being developed. We need to ensure that once they are proven to be safe and effective, they should be equally available to all countries. For this reason, we still insist on a TRIPS waiver, even in its various forms where it can be negotiated. We must invest in strengthening health systems because health systems are what turn vaccines into vaccinations and tests into testing. We need research and development to adapt our tools and stay ahead of this mutating virus. We need the full suite of countermeasures, they being vaccines, treatments, tests, functioning health systems, and personal protective equipment to fight COVID-19 and to save lives. And the world needs the ACT Accelerator to make this happen. This initiative exists to fulfill the most vital purpose of all, to save lives. We cannot falter, and I'd like to say, this is an area where we dare not fail. It is therefore necessary that global leaders should come together to fully fund the ACT Accelerator new strategic plan so that we can continue with our work to save lives and so that we can end this pandemic, not just for some, but for everyone, especially in the most vulnerable communities. I'd like to thank you for this opportunity to address you all. Thank you very much.
Thank you, Your Excellency. Thank you, my brother. Thank you also for your transparency, for the transparency South Africa shown, and for leading the way. But we're also disappointed that many countries imposed a blanket travel ban. Transparency should be rewarded, not penalized. And we're also concerned that other countries may be discouraged to be transparent, actually, for the future. It has an impact. So we're very, very concerned. But at the same time, we're happy to see that Switzerland and France have reversed their decision. And I hope others will follow. So thank you so much for your leadership. That shows your leadership. And we're very, very glad that you're showing the way. And I hope the world will understand and move in the same direction and uphold the principle of transparency that will help us to defeat this pandemic. Thank you again for your continental and global leadership. And it's now my honor to hand the floor to His Excellency, Prime Minister Sture of Norway. Prime Minister, you have the floor.
Thank you, Dr. Tedros, Director General. President Ramaphosa, I'm honored to be chairing this with you and colleagues and friends. Thank you for linking up. Now, taking stocks of where we are almost 2 years into the pandemic is a sobering experience. And the Director General...
The U.S. Senate has approved a Republican measure that will overturn President Joe Biden's COVID-19 vaccine or test mandate. The vote was 52 to 48, with 2 Democrats joining 50 Republicans in overturning the regulation.